Hi, Claire. Thank you so much. What a fantastic presentation. And thank you for joining me to answer some questions that we've been given from our families. So the first question is, I feel like we're on a game show. How many latex clinics are there in the UK? And how can those in the remoter areas get access to help?
Okay, so there's latex services right across the UK that provide care for children and adults who've been treated for childhood cancer. I've recently sent you the CCLG directory, haven't I?
Thank you.
The problem is that all centres provide different level of service, so you need to check with your local centre as to the service they provide. Some provide paediatric and teenage and young adult services for adults. It really does depend across the country. Currently, only Bristol has got a specific latex of ALD clinic, which is delivered by virtual appointments, as I mentioned earlier, like we've only just started this year. Yes. My colleague, Dr. Rachel Cox, so she's emailed all her colleagues across the site UK to find out who does what. And she's come up with it. UCLH have got a small number of adults accessing their service, but most other regional children's cancer centres have got little experience, unfortunately.
Thank you, but thank you for sort of doing that extra work for us. And I assume that if a family came to us and we couldn't find somewhere, we could always contact you, and you could perhaps advise where would be best for them to go.
Yes, yeah, I think so. I think probably if the or the centre that's nearest to them for advice, the centre where they were treated. That's probably the best thing to do in the first instance, I think.
Yes.
Advise about what they can provide.
So how has COVID-19 affected accessibility to mental health, psychotherapy services to help young men suffering survivor's guilt or fertility worries?
So this is absolutely massive at the moment. Unfortunately, the mental health challenges around COVID and the lifestyle just by the pandemic have put a huge burden on mental health teams, both in the NHS and also charitable foundations. Yeah. At the moment, adolescent mental health services are prioritising those greatest at risk of self-harm, and there's unfortunately been a huge increase in eating disorders too. So during the pandemic, mean that lots of appointments are virtual rather than face-to-face. Although certainly here at the Children's Hospital, we're implementing more face-to-face, and I know the psychologists are. I think COVID's affected waiting times, and so they're really long. And so there's an opportunity. People are having to differently seems we're setting up sort of group sessions where patients share similar problems or worries. This is likely to mean sort of increased waiting time to discuss the issues that everybody's sort of suffering. It's really, really difficult. So it's not ideal health services, but as with everything across the NHS, I mean, is that helpful?
Yeah. Yes, no, absolutely. Because I mean, we all know that mental health services have been struggling for quite some time, and then we add in COVID, and a lot of young people have been really affected with not having school, etc., haven't they? It's been a really difficult time for lots of people.
A friend who's a mental health social worker in Northern Ireland, and she said that lots of people who have sort of just tick along with sort of a little bit of mental health difficulties, a few little issues. Actually, the pandemic has really tipped those people, and so not everybody, but some people, and so that's where you might take along okay. COVID is really been very, very difficult for some people.
Yeah, definitely. And just sort of moving on from that, are there any specialist mental health or psychotherapy services available nationally or just at selected centres? And then following on from that, are there any latex clinics that have a special service for ALD patients, which I think you've probably answered already, in that Bristol is currently the only centre who's specifically seeing ALD patients.
That's fine. Unfortunately, to our knowledge, there are no specialist services provided for ALD patients. Access to specific latex psychology support is available right around the UK. But for many people, access to mental health resources will be through local teams. accept direct referrals or through referral from primary care. Just waiting times by the primary care are really long. Charities like Mind and Samaritans provide access right across much of the UK and provide brilliant services. Also, each sort of integrated care system, each setup will have its own referral pathway. So our psychologist for a few sessions and then be referred to sort of somewhere more local to their home for sort of specific issues. So
yeah, so I suppose it's speaking up. If you do feel that you have mental health issues or problems, that actually you speak up. And in fact, we've got a presentation about mental health later on, and yeah, it's just making sure that you do speak up and tell people that you're struggling is kind of one of the most important things.
Samaritans have got a crisis helpline. I actually saw a patient in the last few weeks who called that, and they're incredibly supportive in that moment of crisis. And likewise, Mind. I know that in Wales, Mind have got, I don't remember the name of it, but it's like a supportive pathway, so you can phone them and then they sort of will arrange for you to speak to somebody for sort of 6 weeks weekly. And so there's lots of sort of things available, but there's definitely phone lines that people can call if they're feeling really desperate. But the main thing is to talk.
Yeah, definitely. Now, we know that VMT causes infertility or can cause infertility. So if a male was too young for sperm collection, what are their chances of being able to have children?
So the chance of being able to produce sperm depends on the chemotherapy that they've received. And I talked a bit about that in the presentation, but it is very individual, which is why it's important to know the treatment that you've had. Testosterone produces different sperm producing cells. So unless you've had radiation to prepare the body for transplant, then testosterone levels should be normal. And so, normal development of male characteristics, that shouldn't be an issue. The first step in exploring fertility would be to ask your GP for referral to an assisted conception, so IVF. This would be relevant for 2 reasons. Firstly, you need to arrange a semen analysis to look at sperm numbers. And if there are sperm, to see how they move. This will give an indication of natural fertility. And secondly, then to talk about it's all an assisted conception team, but the role of assisted conception and screen for ALD2. So that's where the whole genetic side of things comes in, which I think you've probably talked about this weekend.
Yes.
If there's no sperm, unfortunately, present on the sperm analysis, then an assisted conception team can also advise on options like using donor sperm or adoption, and fostering can be considered. So there's lots and lots of different pathways, but the first step would be to talk to the GP about the referral.
Great, thank you. And so I don't have access to my child's medical records from the time they had the bone marrow transplant, and so how will I know if he's at risk of any kind of after effects, so from the BMT, so the kind of heart, lung problems that they may?
Yeah, that's fine. So patient's parent apply for copy. Information to this access is usually obtained through patient liaison services. At the hospital where they were treated. So here at the Children's Hospital, we've got liaise. They're based down in reception. They're there for sort of patient complaints, anything like that, but actually also for things like applying for your medical records. So anybody can do that, but you have to get permission and you have to go through the proper sort of lines. I think that would be the best way to get that information, would be to apply for a copy of the records. Then they can have a look at that, or take it to somebody who would know about it. And then the first step is to do that.
Brilliant, thank you. That's really great signposting. And just our last one is, how can we encourage young men to access these services once they're post-18?
So a tricky one, we can't sort of make people come to clinics and things. No. Post-effects clinics basically are advocates for health and provide a source of specialist information for professionals and for patients, actually. These clinics, as we talked about earlier, don't take over local care pathways and GPs. Specialists like just would be really key to ongoing care. It's interesting, actually, often young men don't access health services as frequently as young women. Mm-hmm. Post-effect services can be accessed at any age, but we find it's not unusual, actually, for teenagers and young adults to stop follow-up for a period of time and then return so they get to late teens, early 20s, their lives are busy, might go to uni, starting jobs, and actually aftercare isn't high on their list of priorities. But then, interestingly, they tend to come back to the service sort of mid-late 20s when they're starting to think about settling down, fertility, all that sort of thing. So we very much find that if people do drop out of the service, they will come back when they want to know that. So the appointments are more about sharing information, and we don't actively treat new problems. We've talked about that before, but and attendance is optional. We're not going to make people come to appointments you can't, especially at that age. We can make bespoke plans for each person, so it's very, very individual. So we might see people yearly, we might see them 2 yearly, we might see them 5 yearly, depending on the issues they've got. But for some people, actually, a one-off appointment is enough to understand the risks and issues related to having a bone marrow transplant, and they've got the information. That's absolutely fine. But for others, actually, a yearly appointment is quite beneficial, and we find that quite reassuring. So it is. You can't make appointments, but I think it's just about, as I talked in the presentation, about health promotion, trying to support them through that, and just really.
I think it's just also knowing that there's someone there who can help to either answer a question or send you in the right direction. I think often you kind of think, well, I don't know who I would go to, for that, and you may go to your GP and they're not really sure how to sort of send you in the right direction. So I know certainly for our ALD patients, Claire, you really have been fantastic, and have really helped with lots of areas. You and Dr. Cox have become a fantastic member of our Bristol team.
It's lovely finding more about ALD and sort of being part of the community. That's been really lovely, so thank you.
Oh no, thank you. And we will keep talking, and thank you for taking the time to answer all my questions.
So thank you. Enjoy the rest of your weekend.
Thanks, Claire.
Cheers.